Very good afternoon, friends. Meeting after a big gap. So, we have missed many sessions of organon as well as the Materia Medica. Today, we're going to learn one of the important remedy from fourth year syllabus and which is generally overlooked in our practice also, but very essential in day-to-day practice is hydrocotyle. It is Hydrocotyle Asiatica. This remedy is from Indian source. So this remedy is a wonderful remedy and proving has been done in detail over there. Remedy, if you understand the pathophysiology of this remedy, you're going to understand that it comes from the psychosyphilitic miasm, more commonly on the tubercular or cancer miasm. It has many features, but one of the important feature for which this remedy makes the wonder is the tuberculosis of the skin, as well as leprosy of the skin, the psoriasis, all three disorders which goes in the tubercular miasm specifically comes under the sphere of this remedy. There is cellular proliferation which happens over there and exfoliation of the skin which is very commonly happens in this remedy. So inflammation of the skin where scaling is marked. So psoriasis hydrocotyle plays very vital role, and it is psoriasis gyrate which appears more commonly in the trunk, in the circular spots, and even on extremities, chest, back, and the ages are elevated. These specific eruptions generally comes again in ringworm also, the tinea where the eruptions are circular, inner parts are central part is getting cleared, and at the periphery, at the annular level, the skin becomes thickened. This type of eruptions is the characteristic of the hydrocotyle. So this is a wonderful remedy for skin manifestations basically. Second important, for which generally it is commonly called, is the female complaints, in uterine complaints. There is a very severe leukorrhea associated with pruritus vulvi. There is a heat inside the vagina. That is one important feature one should not forget. There is a one important feature for which this remedy is, there is marked ulcerations of the uterus associated with the cervical hyperplasia as well as cancer of the cervix. So redness of the cervix of the uterus, that is marked, congestion is there, and along with many times it is a wonderful remedy for cancer of the cervix. So see, the miasm it covers is very typical from psychosyphilitic, tubercular to cancer. Whole story revolves around the pathology in hydrocotyle. Generally, this remedy is used more commonly in 3x potency or even in 1x potency, 1x, 3x, 6x. These are the commonest potencies which are generally used. And even Boericke has mentioned that 1 to 12th of the centesimal potency can be used for the treatment. Generally, I have used this remedy in 3x potency as well as 6x potency earlier for the treatment of psoriasis. Let us open your Boericke's Materia Medica and let us go through the remedy. See, it is Indian pennywood. This remedy is from Umbelliferi family. Curative in disorders that exhibit interstitial inflammation and cellular proliferation in any part. Hypertrophy and induration of the connective tissue. This is very important. Hypertrophy, induration, these are very characteristic features. Pathology is explained over here. Have considerable reputation in leprosy and lupus where there is no ulceration. That's why the word which is used in over there is lupus non-exudens, where the ulcerative stage is not yet opened. That is, it is not opened tuberculosis of the skin. This remedy is very important. The skin symptoms are very important. Of great use in ulceration of the womb, difficulty in maintaining the upright posture, very copious perspiration, pains of cervical cancer. Very important pathology. Face, there is pain in left cheekbone with and about the orbits. Female pruritus of vagina, already we have discussed. Inflammation of the neck of the bladder, heat within the vagina, granular ulcerations of the womb, profuse leukorrhea, dull pain in ovarian region, and cervical redness. So congestive pathology in the uterus and cervix plays very vital role over there, including the cancer pathology. Skin, very important. The dry eruptions, great thickening of epidermoid level layer, as well as exfoliation of the scale. Psoriasis gyrate on trunk and extremities, palms and soles, pustules on the chest, circular spots with scaly edges. So this looks to be a ringworm-like eruptions, or sometimes even psoriatic patches, which appears in the similar fashion. So circular psoriatic patches where the edges are elevated, that is called as an annular psoriasis. Annular means peripherally developing psoriasis. This remedy is very important. Intolerable itching, especially of the soles, profuse sweat, syphilitic affections, acne, leprosy, elephantiasis. Arsenic is one more indicated remedy for elephantiasis. This is one more. Lupus non-exudans means it does not lead to any ulceration. That is the indication which is mentioned over there. Dose generally explained by first to sixth potency by Boericke, but 3x, 6x potencies are wonderful potencies to be utilized. So this remedy one should not forget, specifically in cancer cervix, psoriasis, psoriasis gyrate, the annular psoriasis, then tuberculosis of the skin called as lupus, and as also for the leprosy. Wonderful Indian remedy one should not forget. Thank you.